So it's so topical, it's so hidden, it's so interesting, and how clever to put together this incredible panelists of medical professionals who are both sides of the coin, have experience on everything. So I won't go on anymore. I'm just really excited to be here. Thank you all for taking time with your sandwich for our session. We're delighted to be here. So first of all, beside me here is the brilliant and wonderful Alison McCann, who is an OT, occupational therapist. I don't have to break that down for people in the room, and has been 18 years with the National Rehabilitation Hospital here in Dublin. Next is Magella Cassidy, also OT, specialising in dementia. It's lots of fun in my house. My mother has dementia as well, so we're just out the door. So you're going to get a couple of knocks with her. And last but not least, the brilliant Myra Barry, psychologist also as well. We'll come to you guys in a minute. We'll have a chat about your experience, both sides of the coin. But also we had a fourth panellist, Dr. Niamh Lowe, who's a psychologist, who again has a very interesting, complicated story. Interestingly, she acquired her brain injury after she had did her degree, and then her thesis, which I found fascinating, was on brain injury and loneliness. And brilliantly, she couldn't be with us because she just became a mum 2 weeks ago. So give her a round of applause. Into the universe. But ever the hard-working striver, she has recorded a lovely video for us about her story. So before we dive into the panel, we'll watch Dr. Niamh Lowe's video, please.
My, I suppose, journey in brain injury started in 2010. So I had just finished my undergraduate degree in psychology in the May 2010, and then in that July I was involved in a road traffic accident. So it was a single vehicle incident, so there wasn't anyone else involved. There was oil on the road, the car slipped, spun, and I hit a tree. So, and I was unconscious, so I don't have any memory of, being brought to hospital and all that. I was transferred up to Dublin at that time. It was a local hospital I had been admitted to first. And so I was in a coma for 10 days at that time. It was diffuse axonal injury was the I suppose diagnosis, and so yeah, they weren't sure if I was going to wake up from it. I did, but when I came around, I couldn't talk or communicate, or my short-term memory was quite impacted. I couldn't walk, so there was a lot of, I suppose, quite physical and quite physical, like visible injuries. But all in all, I think between the local hospital, the hospital in Dublin, and the rehabilitation hospital, I was kind of in an inpatient for about 5 months around that time. And I suppose at that stage in hospital, and kind of in the early days after the injury, and when I say early days, probably even up to a year post accident, I was very focused myself and my family, I suppose, and friends on the physical kind of markers. So, my walk, my gait, getting back driving, kind of increasing independence, that took my focus. And I suppose it wasn't until maybe a year post accident where my emotional kind of processing of the event and the adjustment afterwards kind of came into, I suppose, became more obvious. And at that stage, my parents were kind of reaching out to the community organizations, like brain injury community organizations, saying Niamh's mental health is kind of deteriorating here. She could do with some psychological input. And psychological input kind of came at that time, again, in the kind of neuropsychological assessment, battery of tests, looking at how I was functioning cognitively. So that kind of wasn't maybe meeting the emotional need or the trauma processing part. I suppose I felt very much shattered entirely. I looked, again, it's that kind of invisibility aspect of brain injury, but I looked as I had maybe prior to the accident, but I felt completely broken and shattered, and that wasn't really being addressed by services. Well, that was my experience at the time. So what happened, kind of, even I was kind of calling out for it. My parents were calling out for it, but I suppose my emotional needs weren't really met by services going through. So it ended up that my mental health did deteriorate kind of further. Depression and suicidality, I suppose. And I was admitted to a psychiatric an inpatient unit for 2.5 months, I think. And it was there that I suppose I had access to psychology and psychotherapy, and maybe more the emotional processing, trauma processing of the event itself, and kind of the adjustment I've had to make in my life since the accident was acknowledged for the first time, and that, I suppose, allowed me to heal a little bit, or started the healing process, and started the process of me being able to acknowledge to myself what had happened, and that this wasn't just a physical injury.
That's it. Round of applause, please, Dr. Niamh Lowe. And a big round of applause. She's had a baby and she's doing very well. Loads to unpack there, but before we do, who would like to go first? Alison, are you comfortable to go first, or would you like somebody else to go first? Yes? Okay, so take us back to when you first knew something had changed. It's on, I think it's on, yeah. Something had changed. Yeah, there you go.
Can you hear me?
Yes. What was going on?
Okay, I'm going to start actually at Christmas in 2019, and I'll speed up quite quickly then to June 2020. So Christmas 2019, I had a dreadful flu. So dreadful that my mother kicked me out of the house on Christmas Day and told me to return to my own house with my Christmas dinner in a lunchbox, which just wouldn't be like my mother. So off I went, absolutely dying with this dreadful flu. I recovered from that, and in February, March, we heard about COVID. Then my mother said, I think you had COVID at Christmas. But back then, there were no antigen tests or anything like that.
Were you still working as an
yes,
OT?
I was. Yeah. Yes. And actually, the HSC, our health service executive here, then said that anyone who is presenting with a cough, you will all remember, anyone who is presenting with a cough must have a negative antigen test before they return to work. So I was still coughing and needed a negative antigen. So in March, I did my antigen and had a negative antigen test. I had dreadful sinus problems after, in March, April. And actually, towards the end of March, I developed shingles along the trigeminal nerve. So are you familiar with the trigeminal nerve?
I am now.
Yes. So the trigeminal nerve is a nerve that comes from the back of the brain all the way through the brain, and has 3 branches. One that runs above your eyebrow, one that runs down along under your eye, and then the 3rd branch runs across your hard palate in your mouth. It subdivides, and then along your jawline here, and kind of can wrap itself around your lower teeth. The one along your hard palate can also innervate your tongue. So, and it has sensory and motor components. So, around at the end of May, beginning of June, I began to feel funny feelings in my face and along my tongue. It felt like I'd eaten a lot of chili. It was on and off, not very consistent. And then it started to feel like I had eaten a whole bag of popping candy. Do you remember that stuff? And then when I stuck my tongue out, it looked like it was dystonic, so trembling movements on my tongue. And along with that, I had developed a lump on my face again. So shingles had returned, and had returned with vengeance. And during the re-emergence of the shingles, I had developed encephalitis. So encephalitis is an infection in the brain, and it's when I had autoimmune encephalitis. So that's when your immune system is so suppressed that it starts to attack healthy tissue in your brain and cause inflammation. So I approached some colleagues at the hospital, and they all told me I looked wicked. Thank you very much. And my manager said, you need to go home. So I drove home to Wexford from the National Rehabilitation Hospital. That's 100 kilometres drive. It was about 2 o'clock in the afternoon, and I prepared dinner, left it simmering on the hob, and I sat on my sofa with my pen in my hand to write a list of things to call my GP about and make an appointment. And I sat writing, and suddenly the pen dropped from my hand, my arm went up like this, and I had tremors. My face jerked and my head jerked, and I had tremors all down my face. I tried to call for help. I couldn't hear my own voice. In my head, I said a prayer. I then collapsed on my sofa, and I said in my mind, oh my God, I've had a seizure. I'm off the road. So that's all I was concerned about, that I was hanging up my car keys.
Always the medical professional.
Yes, wow. I was hanging up my car keys. Wow. Because I was so used to saying this to my patients.
Of course.
Okay, I'm afraid you're 12 months off the road, whatever. We have to follow doctor's orders. So when my sister came home from work, she's a public health nurse, I come round and I called her and I said, you need to come round, I need an ambulance. And we called the ambulance, and off I went to Wexford General Hospital, where I spent 6 days. There I had frequent seizures. A number of them were tonic-clonic seizures, so quite severe seizures. Those I don't recall, thankfully. I do recall the ladies in the beds across from me, who are all elderly and extremely traumatized, watching me having seizures. It's an extremely traumatic thing to witness, never mind to experience. And that is something that I'm ever grateful to COVID for. I was explaining to Professor Delargy earlier.
Explain that, please, yes.
So, when I was admitted to hospital, COVID was in full swing. It was June 2020. So my family, my relatives were not permitted to visit me. So I spent 15 weeks in hospital as thankfully the wonderful team in Beaumont tried to stabilise me. I was then transferred to Beaumont Hospital here in Dublin to the epilepsy monitoring unit, and during that time was COVID. My family weren't allowed to visit, and seizure activity is an extremely, some of it can be very subtle. Okay, I can have a seizure right now and you would not know that I'm having a seizure. The focal seizures, absent seizures, and so on. Then I could have a tonic-clonic seizure or status epilepticus, where you need to call an ambulance, and if you don't, I could have very severe brain damage. And it's very obvious that I'm having a seizure. I know that if I feel like having a seizure right now, I can put my hand up and my colleagues over here know to help me. I'm fully alert when I have a complex partial seizure. That's the type of seizure that I have. And my family have found it extremely traumatic observing seizure activity. I was discharged home from Beaumont Hospital, very unstable with seizures. And also when I went to the National Rehabilitation Hospital in the dead of night, undercover, many of my colleagues didn't even know that I was there for 5 weeks having rehabilitation. Thank you to everybody for helping me with that. But I was high on steroids to try and help the encephalitis, the swelling on the brain, to be managed. And once those, sorry now my word finding, once those steroids had been withdrawn and titrated down, the seizure activity re-emerged. So I'm currently, unfortunately, not seizure-free. I have about 4 to 5 seizures per month, which is a huge improvement from 200 seizures in 24 hours.
Wow.
In my first in the first 24 hours in Beaumont Hospital. It took a full year for the team in Beaumont, in Oxford University, in Germany, and in London to discover exactly what caused the encephalitis. Was it the zoster virus, which is the shingles that emerged here on my trigeminal nerve, or was it something else?
Have you discovered what it is? What it was?
Not concretely,
okay.
But they are treating it for the zoster virus. It looks most likely that it is zoster virus, and I am responding well to the treatment for zoster virus encephalitis.
Okay.
So every 12 weeks, I return to Beaumont Hospital for 5 days for IVIG, which is an immunosuppressant therapy. I receive that over the 5 days. It's titration into a vein for 4 hours, and I take 124 oral tablets per week. The majority of those are anti-epileptic drugs.
Okay.
Some of them are to help manage diabetes type 2, which unfortunately is a side effect of the high doses of steroids.
Yeah.
And I was predisposed to diabetes type 2 through a genetic link. And then some of that medication is just to boost my immune system.
So tell me this, your story is unbelievably compelling and you tell it really well. So just to say, well done. Kind of a round of applause, please, for Alison. You told that really, really well. And it's incredibly compelling and it's very traumatic and I can't imagine what it was like to go through. I'm going to jump you through because the problem in this room is, and the problem with the panelists is you know too much, right? So you're not just this patient on the end of a list. You know what's happening. You're very aware, and also your colleagues are dealing with you. But going in the dark of night back to the hospital you work in as a patient, I have to ask you, what was that like?
That was one of the top 3 most traumatic experiences.
Yeah.
So the top 3 traumatic experiences were speaking to my parents on the phone when I was eventually able to speak, because my speech center is the part of my brain that took the biggest knock from all of the inflammation. And all I can say is that the first sound I made sounded like a primal scream. Yes, it sounded like a primal scream.
Okay, yeah. And then going back to the hospital, yeah.
The second most traumatic experience was when my right arm was paralysed from the seizure activity. And nobody showed me or could tell me why this was happening or how to help it to recover. But suddenly my OT brain kicked in. And I said, oh my God, Ali, wake up. You can do this. So start your sensory rehabilitation, your desensitization program, your proprioceptive rehabilitation program.
You got this, girl.
I got this. And I got it to work again.
Good for you.
And my arm
Good for you.
My arm is working again.
Good for you.
But I'm still working on it.
Yeah.
Yes, dexterity is perfect, but proprioceptive wise, it still feels sometimes a bit funny. So when I have my right hand resting over my left hand and my eyes are closed, I'm never sure really whether my right hand is under or over my left hand. Okay, if that makes sense.
Yes, absolutely.
And then the third most traumatic experience was when I sat on the bed in room 7 in the Willow unit, and Janet came in to admit me. Oh. And she put the name tag on my arm. Oh. Yes.
Yeah, that's really hard. It's hard, but you also know a lot. So you are an oracle now of all of this information. So in at the end of the day, you've got a lot of information to share. So I'm going to give you a little break for a minute because I want to talk about your rehab, and I'm going to talk to all of you about your rehab. But I'm going to move on to you, Majella. You're also an OT, and I'd like to hear your story, please. It's on, I think, yeah.
Yeah. Mine started back on September 20th, 2018. So just under 5 years ago when I was 36, just a few days after my 36th birthday. And I got up that morning. I had a bit of a chest infection.
So just give us a window on, you're working.
I was working as an occupational therapist in a stroke rehab unit.
Okay, in Drogheda.
In Louth County Hospital, which is in Dundalk. Yeah, it's connected with the Drogheda Hospital, yeah. And I woke up that morning. I was living with my parents at the time, and I felt I had a chest infection, so I was feeling unwell. But there was no one to cover in work, so of course I ended up going in. But my mum looked at me and told me to go back to bed. But I actually, thank God, I was that stubborn person and went into work, because when I had my stroke, I would have been on my own then.
Right.
So anyway, I got into the car, drove to work. I was on about halfway to work at this point, and I started to cough quite heavily. And I did one massive big cough, and then I felt really sick. I felt like I was going to throw up. So I pulled the car in at the side of the road, and I felt like I was going to get sick. But I must have said something maybe out loud, because my speech started to sound funny. And I looked in the mirror and I had a facial droop. And then I was like, oh, okay, something's not quite right here. So I was thinking, if I just drive myself to hospital, I'll get a doctor there. Yeah.
You medical professionals. Ask for help.
So I tried to put my foot on the clutch. And it wasn't strong enough to put the clutch down. And then I noticed that my hand was on the gear stick and I couldn't even feel it or move it, my left hand. So I actually got myself out of the car because I felt like I was going to get sick. And I got myself out of the car, but I was on the ground at that point. And then my phone was sitting at the gear stick. So I tried to get back into the car to get my phone, but of course I had complete dense weakness then on my left side, no movement at all.
And at this stage, being you and the job you do, you're like, I'm having a stroke.
Yeah, well, it's really interesting. So I knew I was having a stroke. So I was like, you're having all the signs and symptoms. But at the same time, in my head, I'm going, even though I worked with younger people who've had a stroke, I was like, no, I'm too young to have a stroke. I'm an occupational therapist working in stroke rehab. Just like, it's just not, it just can't be happening to me. And also, I had no really risk factors or, it wasn't a chest infection. I wasn't feeling anything unwell. Yeah, anyway, so I was out and I was actually on the ground at the side of the road, and thank God 2 women drove by and stopped. And they knew I was having a stroke because of actually the FAST campaign. You've heard of the FAST campaign. So they knew I was having a stroke, and they called the ambulance, and that I was FAST positive. Now, stupidly, I don't know why. I suppose maybe it's because I'm having a stroke at the time. But
you might have been a little stressed.
I was just a little.
Yeah.
They were telling the ambulance, the person on the phone, that I was FAST positive, and I was telling them, no, I'm not FAST positive. And I had complete slurred speech and dense weakness on my left side. So your brain is working, one half is kind of working and you're having it, but then the other is just, it's kind of la land, But anyway, they called the ambulance. Ambulance came, brought me straight to Drogheda. And that's where that's where I worked, I worked in the Louth County Hospital, but I knew everyone that worked there.
What was that moment like?
Yeah, well, actually,
what were you wearing? Were you wearing?
I was wearing my uniform.
Your uniform.
I was wearing my uniform. I was in my green trousers.
And you're going into the hospital in your uniform on a stretcher.
Yeah. So the ambulance door is open, and Fiona is the clinical nurse specialist who I know from working with, and she's seen the green trousers. She couldn't see me, obviously, but she's seen the green trousers lying on the bed in the ambulance, and she was like, "It's either an OT or I can't remember what else. An ambulance crew member, because they wear green as well, don't they?" So then when she seen it was me, obviously she got a shock. So I was brought in, and they assessed me to give you thrombolysis, which is the clot busting drug. And they were doing that door to needle time, so a lot of people will know that. So their record was 27 minutes, and they broke it with me, so they got down to 23 minutes. So that's from when they bring you at the door, when you arrive at the door with a stroke and you're FAST positive, to get it into you. Yeah, so 23 minutes. Yeah, and it was it was the consultant that I work under daily that was the consultant there. Anyway, so what they did was then they've done all the scans to make sure that it's a blockage and not a bleed. So mine was a right middle cerebral artery invert, and I was, as far as I know, was completely occluded, so it was blocked off completely. But I was then appropriate for a thrombectomy up in Beaumont. So they shipped me up to Beaumont for a thrombectomy, and I had the thrombectomy there. And you're sedated, you're not unconscious, you're sedated, so you can kind of hear what's going on, but you kind of come in and out. And I remember I think it was Dr. John Thornton, who's the radiologist, he asking me to just hold my head very still, because I remember it being very, very painful just for now a few seconds. But I remember going in my head, and this is the professional part of me going, I know what he's doing. He's poking around there in my brain. I better hold it still.
I'm not sure about knowing all this stuff.
I held it very still anyway. And within a few minutes of that happening, he just told me to lift my left leg in the air, and I could lift it right.
Wow.
And then by the time I left Beaumont and got back to Drogheda, they actually, it was again Fiona that said that the first thing I did, and everyone was really kind of delighted with this, but apparently the first thing I did when the ambulance opened and there was people waiting for me, I waved with my left hand. So
to let them know.
Yeah, I could move my left hand. Yeah, but I had my stroke at 8:20 in the morning, and I was back from Beaumont with almost full function by 12 o'clock. Yeah.
Wow.
Yeah. So
wow.
Yeah.
That's hard to get your head around, isn't it, really?
Yeah. So very, very lucky. Yeah. Very, very lucky. Just everything happened perfectly for me. I'm just, I'm very grateful for that.
And did you have to have rehabilitation after that, or?
So I spent 6 days in Drogheda Hospital. The only reason I spent 6 days actually in Drogheda was because they just couldn't find a reason for my stroke.
Yeah.
I had no risk factors. As far as I know, I didn't have high blood pressure. I didn't have high cholesterol. I remember being a bit stressed in work, but that was probably about the height of it. So mine was actually from a carotid dissection, so where my carotid artery had just like a little tear in it. So that's what mine's from. And they think it's from me coughing so hard. Yeah, that I tore. Yeah. Or that at least when I coughed, I definitely threw off a clot and that went up into my brain. Yeah. So, but the dissection could happen at any point. I had they asked me, did I have my hair done in the previous, and I did have my hair done on the Wednesday, and that was because your neck goes, over the back of the. I don't want to scare anyone not to get their hair done here, but it's it's like a strange.
I'm going to talk about how your professional perspectives changed and how your life changed after that. But I want to get to your story as well, please. Myra Barry, psychologist. So can you grab your microphone there? You're sitting one there in the chair, and tell us your story. It's on, yeah, go for it.
So, my name is Myra Barry. My background is in clinical psychology. At the time of the aneurysm, I was working in Temple Street Children's Hospital for 20 years. It happened in 2019, 3.5 years ago. Out of the blue, I had the aneurysm, a grade 4 bleed of the brain. I had worked the day before, and I, or nobody else, noticed anything awry. When I had the aneurysm, I was fortunate as well, in a different way to you, Michelle. I was visiting my sister and her family in Cork, and they called an emergency ambulance. And they all said the paramedical staff were wonderful. They started working on me straight away. I spent the first 3 weeks in intensive care in Cork University Hospital in a critical condition, and then was transferred to the high dependency unit in the hospital and subsequently the neurology ward. I have no recollection. Still, no, I don't expect I ever will have. I have no recollection of the first 5 weeks until they did an operation and inserted a permanent shunt in my brain. From when I remember, I was totally dependent. I wasn't able to feed or dress myself. I wasn't able to walk, or I wasn't able to toilet independently. After 3 months in Cork University Hospital, I was transferred to the National Rehabilitation Hospital in Dunleary as an inpatient for a 10-week intensive rehabilitation program. I made great progress in Dunleary, and after the 10 weeks was able to return home to my own apartment in Dublin with the support of family and friends. I know now in my body and bones that every brain injury is different. The biggest challenges for me were mobility. I have a left-sided physical weakness, particularly in my left foot and leg. Hence, I was afraid to jump down off the ramp today to look at Niamh, the psychologist, talking. The other area of biggest challenge for me was fatigue. I suffered from extreme fatigue, which was and still remains a challenge. Cognitively, I had much slow speed of processing, and I have much slow speed of processing and memory difficulties. But there was a general slowing down. I'm just not able to go fast anymore or multitask. The psychologist in the NRH in Dunleary referred me to ABI Ireland for a community rehabilitation assistant. And I remember wondering at the time, do I really need that level of support? And the rehabilitation assistant came on stream quite quickly. And I've engaged with her now for almost weekly for 2 years, mainly online due to COVID. and she's been a great help in terms of my continued progress. I retired from work last year. I was coming up to retirement age anyway. And now I've started to embrace and enjoy my retirement.
Congratulations, Myra. Now, your stories are really, really worth hearing, first of all. So thank you so much for sharing. But we've let all of you tell your story because I think as medical professionals, it's apparent what you learn, but I want to hear it from you. So words that I'm hearing is fatigue. You all nodded furiously when Myra said fatigue, and trauma. So it seems there are certain pathways that aren't being met that people like Acquired Brain Injury Ireland are stepping in to meet some of these areas that need to be dealt with. So we've a room full of medical professionals, practitioners, therapists here right now. So I'm going to start with you, Alison, just to say, what's the one thing from your experience as a medical professional who's worked in rehabilitation for so long and then been a patient in the same hospital, what's the one thing you'd like therapists and practitioners to take away from your story? And I'm going to ask you two the question as well. And take your time.
Just the one thing.
Well, yeah, I put you on the spot. You're a great communicator, by the way, so go for glory.
I feel we need absolutely, now I'm speaking for Ireland, so I know we have multinational, but integrated care in the broadest sense, in the broadest definition of the word integrated care. So, and I just very briefly elaborate. I see endocrinology, immunology and neurology as part of my individual care. Not all the time is that integrated. Okay, that's just one little small example. And they are all under the one roof, okay? But in the bigger picture, in the bigger scheme of things, we need integrated care between, let's say, our national rehabilitation facility with the likes of these wonderful people at ABI Ireland who've organised this World Congress, with people who support me on a daily basis at Epilepsy Ireland. We need to reach in, we need to reach out, we need to know more, we need to support each other. Tertiary services, acute services, voluntary services. It's happening in a small way, but not in the much bigger scheme of things that it could very, very easily happen. As an occupational therapist for the past 20-something years, yes, I knew some things about epilepsy, but I don't think I ever mentioned Epilepsy Ireland. Not once did I mention Epilepsy Ireland to one of my patients. How ashamed, how awful, how ashamed I was. To realise that, to come to that realisation that I never mentioned Epilepsy Ireland, never pointed them in that direction. These are people with expertise on our doorsteps, in our counties, in our regions, who are there to support. Much like Acquired Brain Injury Ireland, we cannot function within bubbles. We cannot function within silos. Yeah. We need to reach out.
You're absolutely right. Okay. Absolutely right. Round of applause, please. Yeah. Go on.
1/2 point.
Go on.
Make sure.
I wouldn't mess with you. Don't worry.
Make sure that you have your income protection.
Oh yes, income protection really important.
Make sure you have your income protection because you do not know what's around the corner.
Yes, and on that, my lovely sister who has had breast cancer and she had small cell carcinoma and then a different kind of cancer in the brain. Nobody has ever told her you have acquired brain injury. Nobody, not one professional has ever said that's why you're humming and that's why you shake. And that would have, that massive, I'm so grateful to be here today and so grateful to hear your story as well. You nailed it, by the way. Well done. Congratulations. Angela, you've got a captive audience. What do we want to tell them, having experienced both sides of the coin?
Can I do it from a professional and
I would love that.
Personal. So from the professional point of view, my experience working in neurology, stroke, brain injury, working with prolonged disorder of consciousness. It's just the pathways, the rehabilitation pathways are just very limited in the community in particular. We kind of are definitely in the area that I worked in anyway. We rely on the NRH really for them to go there, and there's just such a gap then in between acute and rehabilitation services, and also then their discharge pathways after they finish the rehabilitation, if they've accessed it, is again quite limited. You have very young people, and it could have been myself, living in nursing home care, which is just not always appropriate for them. So I suppose that's from a personal point of view, that's my learning experience. But from professional, but yes, from a personal point of view, definitely the income protection thing as well. Yeah, I was lucky enough to make a really good recovery, so I only had 6 months off, and I was covered under that. But genuinely, personally, I was only 36. I had as I said, no risk factors at all. You just don't know what's around the corner. You don't know that you could just have one at any time. And I've always said it, like, not that you can go around all day, every day, appreciating every moment, but really try and do appreciate the moments that mean stuff to you, because it can be just taken away at any point. And you could be left with, like, your life changes. And my life has actually changed, even though I'm completely fine and I'm back at work and I can work full time and I can do all that. My life did change. It was a traumatic event, and I'm probably a little bit more anxious now. But I do appreciate life, and it's definitely one thing to. Yeah.
Yes, thank you so much. Round of applause, please. Myra, I want to hear your wise words.
What would I like you to know? I'd like you to know that rehabilitation works.
Oh, that's amazing.
I'm very grateful to the therapists who helped and empowered me on the journey. I'd also like you to know that rehabilitation is hard work. It's labour intensive, and mainly it's slow. But the results are worth it. It's only in the last month that I've started to walk up and down stairs alternating feet. And it's only in the last week that I've gone up and down stairs without using a rail. The road to recovery, and this is where the job is hard, the road to recovery is not linear. It can be very frustrating, but you need to keep at it. And sometimes you need someone to help you to keep at it. The people who helped me most were the people who were patient-centred, who listened, who heard and accepted where I was at today, and used that to help me to reach my potential. I'd also like you to know that not to limit yourself by the window of opportunity for rehabilitation of 2 years. I've made a lot of progress in years 3 and continue to make progress in year 4, and expect I will make progress in the next few years. Finally, it's very important on the journey, as you may gather from listening to us, that it's important to keep the hope alive and to use the patient's goals when you're working.
Thank you, Myra. Can I have a massive round of applause for our panel, please, and a big cheer. Alison, Magella and Myra, thank you so much. Well done. Professional and patient perspective, I really enjoyed that, and thank you so much for having us today, and good luck with the rest of the convention. Thank you so much, Barbara and team from Acquired Brain Injury Ireland. Thank you, that was amazing.